Aloha, welcome back to General Pharmacology. Let's move the PowerPoint slides and get started with some medical terminology. All right, this course starts out with some prerequisite material that you're supposed to know before you even walk in the door. That's why we talk about biochemistry and cell physiology the first couple of lectures, because usually the first week of school people are wandering around trying to find out where their classes are. So we cover some prerequisite stuff with the first couple of lectures. The meat of the first section is 1.3, 1.4, and 1.5, basic principles in pharmacology. You can't spend enough time learning that stuff and understanding that stuff, because that information is the key, not only to understand how drugs work and are eliminated from the body, but how drugs have toxic interactions. And so if you want to have a good command of that information, please go back and take a look at especially the difficult and abstract stuff between 1.3 and 1.5. Well, after 1.5, we'll talk a lot of, used to only just talk about math, and then we started talking more about math, and then we started adding more and more terminology. And so before we get to section 2, cardiovascular medicine, I wanted to spend some time talking about math and terminology, and right now we're going to talk about medical terminology. I call this lecture nominal nomenclature. I was listening to a couple of people argue about medicine, and they weren't really arguing about medicine. They weren't arguing about physiology. They were arguing about the meaning of words. And sometimes in clinical medicine, the meaning of words seems to directly translate into how things work, and that's not the case at all. And so nominal nomenclature is a funny way of saying the same word twice, and yet nominal is how we name things. Nomenclature is how we name things. But nominal just means, we just give them a name because it's easy. We just felt like calling it that. And nomenclature means there's this specific way that we name things. Like when we talked about drug names, those chemical names, there's a specific nomenclature that we use to give those drugs their names. But there's not a specific nomenclature to the word nominal. Nominal just means, we'll just call it that because that's the easiest thing to do, and then move on and not think about it. And so nominal nomenclature is what I see a lot of in medical terminology. All right, I've had friends come visit me and they're like, hey, I'm in Hawaii. How can I come see you? I'm like, where in Hawaii? Well, I'm in Honolulu. Where do I need to go? I'm like, well, I'm on Maui, so that's not a car ride. We're not really in the same place. You're on a different island. He's like, but I thought you lived in Hawaii. I'm like, well, I do, but I live on Maui. And so those of us in Hawaii, we understand that there is a difference between living on the big island of Hawaii or living in the state of Hawaii or being Hawaiian. All right, and so we understand these concepts, other people don't, but that's the first thing you want to know about medical nomenclature, nominal nomenclature, is that we go through this all the time. Which one of these is Hawaii? Is it all of them? Is it one of them? Well, that depends on what you're talking about. My favorite example to use is the sky. The sky is blue. This is what we teach our kids. Oh yeah, the sky is blue. Yeah, well, is it? Gee, if you look at night, it's all black and full of all these colorful little spots, and if you get to see this sort of thing, the sky's full of all sorts of colors. You sit and watch sunset, it's orange and purple. The sky's not blue, not all the time. All right, I see this plenty here in Hawaii. Nice, beautiful red sunsets. All right. So why do we call the sky blue? That's nominal. We just give it a name. Well, it's blue most of the time. Well, not in Ohio. It's gray all the time in Ohio. It's rarely blue in Ohio. So why did we call it blue? Well, it's just nominal. We just gave it a name because that's the easiest thing to describe the color of the sky. Because describing it, well, that depends on the time of day. It's blue at this time and black at that time and red and green and purple and orange and all these. That gets all complicated and nobody wants to talk that way. And so that's why the sky gets this blue color. But people will interpret that to meaning the sky is blue all the time, and then they'll look out, well, the sky's not blue, it's orange. And, you know, that's silly when we're talking about the sky, but this happens all the time in medicine. We'll give something a name, and then people will think that that name is strict nomenclature. And so it's the same thing. You look at the sky, it's not blue. Well, you know, it's a nominal name that we've given the sky. If you're in construction, you know what this is, a 2x4. And how did it get its name? Well, it's 2 inches by 4 inches. Yeah, that's how it's 2 inches by 4 inches. That's how it got the name 2 by 4. 2 inches by 4 inches. But if you get your measuring tape out, it's not 2 inches by 4 inches. It's 1 3/4 by 3 1/2. All right. And so it's about 2 inches by 4 inches. It's supposed to be 1 3/4 and 3 1/2. When I was a kid, my dad thought the 2x4s were supposed to be 2 inches by 4 inches, and this was just the lumber companies ripping us off over time. That is not the case at all. We give it the name 2x4 because it's about 2 inches by about 4 inches, and I think about 50 years ago they might have been a 1/16 of an inch bigger. So it's called a 2x4 quite simply because of nominal naming, nominal nomenclature. I mean, it doesn't formally mean it's 2 inches by 4 inches, and we get this in medicine all the time. Oh, it's a 2x4. Oh, that means it's 2 inches by 4 inches. No, it didn't. That means it's about 2 inches by 4 inches. And so that's the first thing I want you to know about medical terminology, is that it is not this strict nomenclature that means the same thing every time. They'll use terms loosely. Since I'm thinking of it, like the word malignant. As we go through malignant, malignant means cancer. And so just about every time you use the word malignant, it's going to mean cancer. However, there are things in medicine that are malignant that have nothing to do with cancer, like malignant hypertension. Malignant hypertension just means organ damage is occurring because of the high blood pressure. So malignant doesn't really mean cancer. Malignant means organ damage, and when certain things like hypertension are causing organ damage, we'll call it malignant hypertension, and yet cancer has nothing to do with it. We'll talk about essential hypertension. In the rest of the world, essential means we really need it. We have essential nutrients and we have essential amino acids, and that means we really, really, really need them. And then we have this thing called essential hypertension. We don't need it. We don't want it. It's bad. Uncontrolled essential hypertension is not something that we want. It can have lethal consequences if it's not controlled. And it's called essential hypertension because essentially we have no single reason for it to occur. So be very careful thinking that words like essential always mean we need it, or words like malignant always meaning cancer, because sometimes those words will come up in a nominal manner. That means we just gave it that name and never gave it much thought after that. And that occurs all the time in medicine. Ooh, here's a great one. A grain. There's a grain of wheat. All right, and that's how it got its name, back from the ancient times. This was one grain, and if you actually counted out 7,000 of them, that's where a pound came from. A pound is 7,000 grains of wheat. All right, awesome. Well, then they took this into pharmacology. A grain, by the way, is 64.79891 milligrams. If you Google the word grain, it'll tell you this. And is a grain 64.79891 milligrams? Well, yeah, if you're thinking about things in terms of a 7,000th of a pound, as in a grain of wheat. All right. So here we've dragged grains into pharmacology. I don't like to speak in grains, but my partners used to write grains all the time. And they wrote grains in these hieroglyphics that I probably wouldn't recognize today. And we see it all the time, and we can say, oh, well, don't talk this way. But people do, and you need to be able to recognize it. All right, so here's phenobarbital from ECI Pharmaceuticals. And there's the NDC number if you want to look it up. And here, one grain is what? 64.8 milligrams. Okay, great. What's a grain? 64.8 milligrams. Let's just round it up from 64.79891 milligrams. That's what Google says a grain is. Right here, a grain is 64.8 milligrams. Here, manufacturer is making Armour Thyroid. One grain is 65 milligrams. Right, that's rounding up 64.8. That rounds up to 65. That's fine. Right, a grain, 65 milligrams. Hey, wait a minute. Here's Armour Thyroid, and a grain is 60 milligrams. All right, so what's a grain? Oh, it's about 60, 65, 64.7 milligrams. So a grain can be 60, a grain can be 65, a grain can be 64.8, a grain can be 64.79891. All right, so a long time ago somebody asked me, well, what is a grain? And I'm like, well, that is not an easy answer, but it's 60, 65, 64.8. And they did not like that answer. They wanted a single exact value for a grain, and they went and asked somebody else, and the answer was 65, but I can tell you a grain is also 60, 64.8. All right, so grain is a nominal term. All right, it's just, we just use that word to mean 60 something. It's about a grain. Right? And we see this all the time in medicine. It causes a lot of arguments. I see a lot of people disagreeing over the meaning of words, and yet the physiology is unchanged by the way we name things. And so we need to be very, very careful about implying that something is exactly the way we've named it. And I think I've made that point. Here's a very dangerous word in medicine right here, normal. We throw that word around all the time, and yet a majority of the people might not have a normal situation. Here's an example. If you study in neuroanatomy, you know what a circle of Willis is, and it's in the book as if it's a normal thing. And yet, really, less than 25% of the population have a normal circle of Willis. 75% of the population, they just have something completely different entirely. 10% of the population has half their brain fed by one carotid artery. All right, so a circle of Willis is not normal in humans, although we call it normal because this is the most common thing that we see is a circle of Willis, but we only see that in 25% of the population. Everybody else just has something completely different. And so there's the word normal, and I heard people arguing about exactly what normal meant, and they had no understanding of what nominal meant or nomenclature. And so that's why we start this way. Oh yeah, good. I'm glad I have these slides in front of me. All right, so we get told by our pharmacology professors that a trade name reflects some kind of generic name. And I'm pretty sure in one of my lectures I told you that Benadryl is the trade name for diphenhydramine. And that's true. And so there's my Benadryl spray. I like to use this when any diphenhydramine spray is fine. And look at that as a diphenhydramine topical analgesic. It's an antihistamine, by the way. And zinc, a skin protectant. That's pretty cool. So if I get weird itchy rashes, I like to spray some of that on it sometime, and that really helps. You know, the cooling effect, the antihistamine. Great. So then one day I'm looking for the Benadryl spray. I can't find the spray. Oh, here it is in a gel, and I see Benadryl at the top, and I'm like, oh, great. I'm going to go home and use this Benadryl. And what's in the active ingredients? Well, it's not diphenhydramine at all. See, does not contain diphenhydramine. Okay. What does it have? It has camphor in it. I'm allergic to camphor, and after rubbing this on me, I ended up with this horrible rash that I needed that for. And so here again is something that you have to know about nomenclature, is that manufacturers can put a trade name on whatever they want. Benadryl can call any generic drug Benadryl. So the trade names are not strictly dedicated to a specific generic drug. We don't have these problems so much with legend drugs that are available prescription, but this over-the-counter business, this happens all the time. A great example is Dimetat. When I was a kid, I took Dimetat, and then they decided it wasn't safe in kids, and they changed the ingredients of Dimetat. They put something else in it, and it's still called Dimetat. It has different ingredients in it, and then they decided that wasn't safe in kids, so they put a completely different set of ingredients in Dimetat. And so something I want to tell you about nominal nomenclature is that we can stick a trade name. They can stick a trade name on anything they want. Benadryl they can use the word Benadryl to describe diphenhydramine. They can use Benadryl to describe a gel with alcohol with camphor in it. So be very careful about assuming that a trade name strictly refers to a generic name, especially with things like Benadryl. Like I'm a sissy. So manufacturers may use their trade names for any purpose they choose. They can change the ingredients in it and still keep the trade name. All right, before we slog through all of the terminology, which probably take me 2 lectures, we're going to cover some of the most common things. And so one of the most common things is hyper, high, hypo, low. Hyper, high, hypo, low. And so hyperthyroid, high thyroid hormone levels. Hypertension, high blood pressure. Hyperglycemia, high blood glucose. Hyperlipidemia, high lipid levels. Emia meaning in the blood. Lipids, fat. Glycemic is sugar. Tension has to do with blood pressure usually. Thyroid, of course, has to do with the thyroid. So here we have hyperthyroidism, hypertension, hyperglycemia, hyperlipidemia. Hyper, high, hypo, low, hypothyroid, low thyroid hormones, hypotension, low blood pressure, hypoglycemia, low blood glucose levels. So this is the most commonly used prefix, hyper and hypo, hyper high, hypo low. U means normal. Occasionally you'll hear this. Okay, we had hyperthyroid and hypothyroid. So if somebody's euthyroid, that means they have normal thyroid hormone levels. And so if you talk to a thyroid expert, they might say, oh yeah, they're euthyroid at this point. That means their thyroid levels are where they're supposed to be. I've never heard the word eutension used. I've heard of hypertension and hypotension, but I've never heard eutension to describe normal blood pressure. And so we can just eliminate that. And again, that's about nominal nomenclature. We can say euthyroid, and that's a perfectly normal term, but nobody says eutension for normal blood pressure. So again, be careful about putting these words together and then using them as names. We'll hear about euglycemia if somebody's well managed with their diabetes. They can either be hyperglycemic or hypoglycemic, but I've heard euglycemic used and described for normal glucose levels. But I've never seen the words eulipidemia ever used, meaning normal lipid levels. So the point here is that just because we have a prefix and a suffix, just because we have a beginning and an end, doesn't mean we get to stick them together and use them in clinical terms. And so that's why these are in gray. I've never seen eutension used or eulipidemia. If you use those words, be sure and let me know. All right, dis is the most misunderstood prefix there is. It's real simple. Hyper is high, hypo is low, u is normal. Dis, something's wrong with dis. It means pretty much anything abnormal. It can mean painful. Now, if dis means pain, there's other things that mean pain as well. And so keep in mind that dis doesn't really mean anything specific except not normal. All right, so a dysrhythmia is considered a normal rhythm. It used to be called arrhythmia, but then people thought, well, that means no heart rhythm? That means you're flatlined. And it's like, no, they just got no rhythm, like somebody who can't keep a beat. So arrhythmia to some people means an abnormal rhythm. Arrhythmia to other people means no heartbeat whatsoever. And so they came up with dysrhythmia, which means an abnormal heart rhythm. Dyspnea, pnea, is like pneumatic, like air. And so dyspnea is abnormal respirations, all right? Well, let's go back. Let's look at dysrhythmia. The patient can feel nothing, and we can see dysrhythmia on a heart monitor and call it dysrhythmia. The exact opposite with dyspnea. If they perceive themselves as being short of breath, they're dyspneic. They decide whether they're dyspneic. Now, we can watch them and see labored respirations, but if they're like, I feel short of breath. Well, you can watch them. Maybe their respiration rate is fine, and maybe they're taking normal inspirations. But if they say, I don't feel like I'm getting enough air, they're dyspneic. They have dyspnea. And so just because we use the word dys doesn't mean it always means the same thing. Dystonic. Tone, as in muscle tone, dystonic. We'll see dystonic reactions, and people will be moving in this irregular way because they're having these abnormal muscle movements due to this abnormal muscle tone. And so here, dysrhythmia, dyspnea, dystonic basically mean the dys means something different regardless of what comes after it. All right, dysphagia means painful swallowing. We'll come back to that. So dys can mean painful. There's other words for painful. But dysphagia just means painful swallowing. Phage, as in to eat, phagia, P-H-A-G-I-A. That's different than phasia, which is P-H-A-S-I-A, which has to do with speech. And so P-H-A-G-I-A is swallowing, P-H-A-S-I-A is speech. So dysphagia is painful swallowing, but dysphasia is not painful speech. Dysmenorrhea means painful menstruation. Dysuria means painful urination. All right, so be careful with this dys word. It just means something abnormal, something's not right. Poly can mean qualitative or quantitative, too much or too many. All right, and so polydipsia just means being excessively thirsty or drinking excessively. Polyphagia just means to eat excessively, and so in diabetics we'll see polydipsia and polyphagia. Polyarthralgia just means they have pain in multiple joints instead of a monoarthralgia. If they have a monoarthralgia, mono meaning one, they have the pain in one joint. But if they have polyarthralgia, they have pain in multiple joints. Polycystic, multiple cysts. Polymer, mer is a chain of molecules. So you've heard of a polymer. Polymer is just quite simply a chain of individual molecules. Pro, pre, and ante all mean the same thing. They mean before. And so a lot of times we'll hear some pro word used in medicine, and it just means pre. Be careful of this ante word. Ante means before. Anti, A-N-T-I, means against. All right, so this is ante, which is not anti. All right, you can have an antibody spelled with an I. That means against, but ante means before. And so this is something I see people missing out on. All right, so proinsulin is the hormone that your body makes before it makes insulin. So it's proinsulin, and then it undergoes cleavage and peptide cleavage, and then it's made into its final form, insulin. We talked about a prodrug. A prodrug is inactive until it's converted into its active form. And so here, pro quite simply means pre. It doesn't mean professional. It just means pre. Precancerous, it's a lesion that could become cancer if we leave it alone. Pre-diabetic, that means if they don't change their ways, they will become diabetic. Right? Prepartum and antepartum mean the same thing, just before delivering a baby, like I'm an expert at gynecology or delivering baby. The antenatum period is before the birth of the baby. And so, again, these words are not used exactly in the same way. So antepartum, prepartum is just before delivery, but antenatum is any time before the birth of the baby. So again, I want you to see not only what they mean, but these examples show you that they can be used in different ways. So do not confuse ante, which means before, with anti, which means against, like an antiemetic. Emesis is to vomit, so an antiemetic is a drug used to prevent or stop vomiting. Or an anticonvulsant is a drug to prevent or stop seizures. An anticoagulant is a drug used to prevent blood clots. An antihypertensive is a drug to prevent or treat high blood pressure. So you can see how this anti word is used as opposed to ante, which means before. Right? I think we've covered all that. Oh, pre, before, peri, during, prepartum, before delivering the baby, peripartum, that means delivering the baby, postpartum, just after delivering the baby. The preoperative period is just before surgery, the perioperative period is during surgery, and then the postoperative period is just after surgery. All right. Peri, around, periorbital, around the eyes. Orbit is the eyes. Periorbital means around the eyes. Periodontal, dental, dontal means teeth and gums. Periodontal is the gums around the teeth. Pericardium is that sac around the heart. Perianal area is the area around the anus, the rectum. Supra means above. Supraventricular is a type of rhythm that we'll see that generates above the ventricles of the heart. If they have a supraventricular rhythm, then that occurs above the heart. Suprapubic means above the pubic region. Sometimes you'll see the word super, and that's different than supra. Sometimes they're used similarly, sometimes they're used differently. Supra means above, higher than, whatever is on the suffix. Infra means below. So supraorbital means above the eyes, periorbital means around the eyes, infraorbital means below the eyes, and we're speaking in the anatomical position. The anatomical position is the person standing with their palms facing forward, and then that's how these terms come from. Center is considered median, proximal, and then lateral is away from the center, and that's considered distal. So be careful about the words inter and intra. Inter means in between two things, like an interstate runs between two states, but an intrastate runs within that state. Interosseous means between the bones. It's a ligament between bones. Will be called interosseous, going from one place to another. Intra means within, though. Intracranial means within the skull. Intra-articular, meaning within the joints. Intraosseous means within the bones. And so when we talk about intraosseous access, we can get IV access by drilling into the bones. And if you do advanced cardiac life support or any kind of pediatric life support, you'll learn about intraosseous access because we can use something similar to a Jamshidi needle and screw it into the bone and use that as IV access. Brady means slow. Presby means slow too. Presby means old, but Brady means slow. So you'll hear about bradycardia as a slow heart rate. Or maybe we'll talk about bradykinesia. Kinesia again means kinetic energy. In this case, it means movement. So bradykinesia means slow movement. And we'll see that in Parkinson's disease. We'll see people walking very slowly. And we'll call that bradykinesia. They're moving very slowly. Well, tachy means fast. So tachycardia is a fast heartbeat. Maybe you're familiar with a tachometer. In a car, that's the thing that tells you the revolutions per minute, how fast the engine is turning, because tach means fast. All right. Here's some abbreviations. This is the most important one. You can know stat from Latin statum. And this means right now, immediately, or depending on the rules of the facility, maybe it's within the hour. All right. So you're going to want to clarify when somebody wants something stat, does that mean they need it immediately? Or they need it in the hour, because some things, if you needed it stat and you had to wait an hour for it, then you would not have a patient. And so determining exactly what somebody means by stat is very important. And so my feeling is that if I wanted something stat, as in immediately, I made that crystal clear. And then if I wrote it on a slip and stuck it in a box and it said stat, an hour would be fine, you know, in front of the line. I need you to know the difference between PRN and ad lib, all right, because these are commonly confused. PRN just means as needed, and over on the right is where the Latin comes from. I don't need you to know that. But PRN means as needed, but ad lib just means anytime they feel like it, all right. So you take Tylenol, PRN for pain, as needed for pain. You don't take Tylenol whenever you feel like it. Hey, I feel like taking a Tylenol. Oh, okay. That makes no sense. Take Tylenol ad lib. Oh, whenever you feel like it? No, so ad lib just means anytime the patient wants to. They want to walk ad lib. All right, let them get up and walk anytime they want. Middle of the night, middle of the day, it's fine. All right, but PRN means as they need it, okay? And so this is going to apply more to medications. It's going to apply to diet and getting up and around. A diet ad lib. That means they can eat anything they want anytime they want. All right, A has to do with when. A as in before. A comes from ante, which means before. I think we've covered that, yeah. So AC, antecedum, is before meals. We used to remember that as anti-chow, ante-chow, before meals. All right, so AC means before meals. PC means after meals. All right, P means post. So PC means after meals. And so some medications, they'll take AC, you'll have to take a POAC, by mouth before meals. Some drugs are POPC, by mouth after meals. HS means the hour of sleep at bedtime. So you're going to see fasting blood sugars taken on people before meals. AC and HS, before meals and at bedtime, not after meals. Please don't do that. Before meals and at bedtime. Okay. So here Q means every day, and there's the Latin for what every day means. And so QD means every day. QOD means every other day. QAM means each morning. QPM means each evening. Anytime in the morning, anytime in the evening. QAM usually means first thing. QPM means any time in the evening. QHS means every bedtime. Take this medication, QHS, every night at bedtime. Q hour, every hour, Q2 hours, Q3 hours, Q4 hours. We hear that all the time if you're in clinical medicine. That's what those things mean. They might be abbreviated instead of H's. They might use that sign right there, the hour degree. And again, this means different things depending on the context. Okay. Yeah. 2 hours, 15 minutes, 30 seconds. There's some abbreviations that we'll see. I don't want you to confuse these Q's with that Q right there. Right? This Q has to be capitalized if you're going to do it properly. I see this in lowercase. Anyway, BID is twice a day, TID is twice a day, QID is, I'm sorry, BID is twice a day, TID is 3 times a day, QID is 4 times a day. BID is twice a day. BID is not Q 12 hours. And so the drug will, oh, we want to use this drug every 12 hours, then the prescription will say twice a day. Well, twice a day just means separated. So you take one in the morning, and several hours later, you can take another one. Take one in the morning, take one in the evening, take one now, take one later. That's what twice a day is. Not twice at the same time. 2 at the same time, that's not BID. BID is take one now, one later, and then the next day do the same thing again. Q 12 hours, that means if you take one pill at one time, exactly 12 hours later, you need to take the next pill, okay? So do not confuse Q12 with BID or Q8 with TID. And this is what I see all the time. Somebody needs to take a medication for QID. That means one in the morning and one before lunch and one in the afternoon and one before bed. That's QID, all right? We can do that while they're awake. What we can't do is give them medications Q6 because we'll have to wake them up all night. And so somebody gets a medication Q6 and we wake them up at 10 o'clock at night to give them a medication, and then we wake them up at 4 in the morning to give them another medication, and they're not real happy because we didn't really need to give the drug Q6, we need to give it QID. All right, so please don't confuse these terms. I saw these confused all the time in clinical medicine. Somebody needs a drug QID, the order's written for them to have Q6, and that means somebody's waking them up in the middle of the night to give them some drug, and maybe it's PRN. So please don't confuse those. Which ear? Oh, this is common. A means ear in this context, and notice D is right, as in dexterity is right. Left is S as in sinister. The opposite of right is left, the sinister. So good, bad. And Unitas is both. And so AD is the right ear, AS is the left ear, AU is both ears. Please don't confuse this with the eyes. OD, dexter is the right eye, sinister is the left, and U is both. All right, so please don't confuse AD and OD with AS and OS and AU and OU. Okay, so make sure you understand these because these are very common abbreviations in pharmacology. GTT means drop, or GTTS means drops. Something you should know is there's this thing called a drop factor. So when you get IV tubing or you have a medication that's dispensed by drops, they'll give you the drip factor. Most commonly, a drop is 0.05 milliliters, meaning its drop factor is 20 drops per mil. Right? And so I'm giving you this arbitrarily because most unlabeled drippers, drop dispensers, drop in this manner. Each drop is 0.05 milliliters, 20 drops per mil, a 20th of a milliliter. All right, but other things will have different drip factors. Maybe you'll have some IV tubing when we're giving dopamine and its drip factor is 60. That means there's 60 drops per milliliter. Or maybe its drip factor is 30. That means there's 30 drops per milliliter. So exact volume of a drop depends on its drip factor, but for a lot of topical things like eye drops, this is close enough. Okay. And drops can go in the eyes, drops can go in the ears. Okay, you can put eye drops in the ears. And so I've had kids with ear infections and they want to use eardrops, and they just use eye drops. They have this giant collection of eye drops, and they can use those in the ears. It's okay to use eye drops in the ears. What's not okay is to use eardrops in the eyes. The stuff that you put in your eyes is supposed to be perfectly sterile and perfectly pH balanced for your eyeballs, and so your ears are pretty tough. You stick it in there and they're like, oh great, this is great. All right, but a lot of stuff we stick in our ears is not pH balanced for the eyeballs and can be very damaging. All right, so just because you can put eye drops in your ears doesn't mean you can put eardrops in your eyes, okay? RX means recipe, it means prescription, and you guys know that. OTC is over the counter. That means the law says that instructions can be used for the general public to use this medication safely. OTC, over the counter. X is the abbreviation for, we're just too lazy to write the rest of it out. And so SX, you'll see that means symptoms. HX, maybe that means history. DX, diagnosis. TX, treatment. Right? Maybe that's what they mean. Maybe they're meaning other things where they come up with the first letter and then don't bother the rest to write of it out. And so that's what X means. X can, oh, we're just too lazy to write the rest of it. Like a biopsy is a BX. Fracture, maybe they'll spell it FX. I always spelled it FXR, fracture. C with a little line above it means with. All right. A lot of times I'll use a C without the line above it, and it'll mean with. Cum, with. And so be on the lookout for that abbreviation. Let's see, without the other line over it, it's supposed to be centimeter. That's one of the things it can be, or cm can be a centimeter. M is milliliter, C centimeter, or M milli, C centa, K kilo. Make sure you have a great handle of the metric system while you're in this course. I don't think we're going to cover it live, but we do have that lecture somewhere on YouTube for you to watch. Make sure you have a good handle of the metric system. So here's some metric abbreviations in here. And we'll cover the metric stuff on another time. Here's something confusable right here, the word micro. MC, they can use MC to mean micro, or they can use the letter mu for micro. The problem is this is easily confused, and so you'll see the letter mu, the Greek letter mu, to be micro, or you'll see MC to mean micro. All right, so if you're going to write it out, just use MC. Please do not use Greek letters. All right. Again, a grain can be somewhere between 60 and 65 milligrams. They'll use unit for big complex molecules that are not easily measured in milligrams. Maybe the molecule would be destroyed if we removed all the water from it so we could measure it. And so when molecules are complex to measure, we'll just call them units. So insulin is a polypeptide hormone. It comes in units. And then some vitamins will come in international units. IV, yeah, that looks like the Roman numeral 4. That's not the Roman numeral 4. That just means intravenous, into the vein. Right, and so here's my cartoon, somebody's cartoon of an IV where here the needle is going directly into the vein, and here is some large volume container, usually about a liter of fluid, and it's dripping into the patient intravenously. IV. All right, so here's an IV. So when we talk about routes of administration, we'll talk about an IV, and then in routes of administration, we'll also talk about an IVP. And in this context, IVP means IV push. That means we're going to use a syringe, push it in the vein in one single injection. Sometimes we have to do that very slowly. All right, so IVP means IV push. If you're pushing medications, right, there's an IV push. Yeah, it's given into the vein, into the IV in one injection. That doesn't mean quickly. Right? Sometimes we have to give it slowly. Sometimes an IV push should take 20 minutes. Right? When we do seizure drugs, we're going to load Dilantin with 1,000 milligrams. We're going to have 1,000 milligrams of Dilantin in a syringe, and we're going to put it in over 20, 30 minutes. All right? So IV push doesn't mean immediately all at once. IV push just means it's given into the vein in one injection. Okay, so that's what IV push means. So be careful when you're giving IV push medications, because some of them, like digoxin and digoxin and Dilantin, they have to be given slowly. All right. So what does IVP mean? IV push. Well, that's if you're on the floor. If you're in radiology, an IVP means an intravenous pyelogram, where they give them contrasted stuff so we can see their kidneys. We wouldn't be able to see their kidneys. So these are the kidneys, and these are the collecting systems. And here are the ureters draining into the bladder. That's what an IVP is, an IV pyelogram or an IV push. Okay, so be careful about all these TLAs, these three-letter abbreviations, because they don't always exactly mean what you think they should. Here's IVP. It doesn't stand for IV push or IV intravenous pyelogram. It stands for IV piggyback. It's a secondary IV. All right, so if that was our IV, then this is our piggyback, where we can add another container and connect it to the system and then add the medication. Again, it's very important to make sure that whatever is in here is compatible with whatever's in there, because if their pKa's are incompatible, one of them can turn the other one into a particulate solution, particulates in solution, suspended in solution, that can be lethal to the patient and cause obstruction. And so keep this in mind as we're doing IV piggybacks. It's not always safe to put this piggyback medication with this medication right here. So be sure and check that if you're looking at an IV PB. I think we've made that point. Yeah, there's an IV piggyback. PO means by mouth. PR means by rectum. Suppositories are given PR. And we'll talk about this when we talk about routes of administration. Vaginal suppositories are given PV. IM means intramuscular. SC means subcutaneous. ID is intradermal, within the skin. Sometimes we'll see subdermal, meaning right below the skin. And so when we give a tuberculosis test, this is like intradermal. We'll just put it right underneath that top layer of skin. All right, so we'll get started with some prefixes. If we run out of time, we'll just pick it up with the next lecture. And we can follow this in our notes. A, an, Anna means not, without. The opposite of ab means away from. So abduction means our arms are sticking out. Adduction means putting together. So abduction means to move away from. Adduction means to put together. All right. Ante again means before. It can also mean in front of and forward. But anti means against, like an antibody so don't confuse ante with anti. Auto means self, so if we have some autoimmune problem, that means our immune system is making antibodies against ourselves. All right, so an autoimmune problem means the immune system is attacking ourselves. Bi, as in bicycle, means to, binocular, to look through two places. Brady means slow, as in bradycardia. Carcin, as in carcinoma, are cancers that start on the surface area of the body. Contra means against. It can also mean the opposite. Like to contradict someone means to say exactly the opposite thing. We talked about dis meaning difficult or painful. Dis is very loosely used nominally in all sorts of ways. So dis doesn't necessarily mean difficult every time or painful every time. It can just mean something's not normal. Ecto means outside of. Your ectoderm is your layer of skin on the very outside of. Exo will also be used as externally. Down at the bottom, exo can also mean outside of. In, as in indo, means within. And so endogenous substances, endo, within. Genus, as in genesis, to form in the beginning. Endogenous substances are formed inside of the body. Exogenous substances outside of the body. Epi can mean outside too. Your epidermis is the same place your ectoderm is, on the outside. The very top layer is the epi layer. Gyneco has to do with women, so a gynecologist is someone who works with the reproductive organs of a woman. Hemi means half. Hemiparesis means half of the body is weakened. Hemiplegia means half of the body is paralyzed. Hyper, above, or excessive. Hypo, below or deficient. Infra, meaning below or inferior to. Inferior to not being, not having anything to do with not as good as. In medicine, inferior just means below, something else in the anatomic position. And so infra means below, like we talked about infraorbital are below your eyes. And so your cheeks, you have these big bones. And this is the infraorbital region that goes to these cheekbones. Inter means in between something, but inter means between two things. Intra means within one thing. So an interstate runs between two states, and intrastate is within the state. And so we use the intra words. Iso means the same or equal. And so like when you do isometric muscle exercises, iso, the same, metric, length. And so with isometric muscle contraction, you can contract the muscle but not change the length of the muscle. And so that's when you hold the muscle in one place and then you fight against resistance. That's isometric exercise. Macro means big or large, like a macrophage is a large white blood cell that eats things. Macrocytosis is large red blood cells in the blood. Meta means some kind of change, some kind of transformation has occurred. And so like metaplasia means some kind of changing in the cellular structure, the appearance of the cells. Mal means poor or bad or abnormal. Like a malady is just quite simply some kind of disease process. Malicious means very bad intent. And so malodorous means some very bad odor. Micro means small. Microcephaly means small head, small brain. Microcytic anemia, cytic meaning cell, micro small. If somebody has anemia, we want to know what the red blood cells look like if they have too few of them. And sometimes we'll see microcytic anemia. Sometimes we'll see macrocytic anemia, large red blood cells. So we have anemia and we look at the cells. Are they large? Oh yeah, that's macrocytic anemia. And we look at the cells. Oh, are they too small? Oh, that's microcytic anemia. Multi means many. You guys know that. Multipole means many. Neo means new. We use this a lot in medicine. So a neoplasm, plasm as in growth, neo as in new. And so neoplasms, we worry about them being cancer until we are able to rule them out. Non is a not, as a non-issue, is not an issue. Oligo means too few, or oligo means few, not very many, a small amount. So oligopeptides are small peptides. Oligopeptides are small chains of amino acids. Penia means too few, and so if you are neutropenic, that means you have too few neutrophils. So penia means not enough, but oligo just means not many at all. It just means small. Pan means all. My friend Dan, his dad flew for Pan America. They're called Pan Americas because they flew all over the Americas. Pancytopenia. Pan, everything, cytocell, penia, too few. And so if all of your blood cells are too few, as in bone marrow suppression, you'll have pancytopenia. Para can be next to, right near, beside. Per and peri. Per means through something. Peri means around, surrounding something, the periorbital region. Poly, again, means many. Post means after, as in like post-surgery. Pre, as in before, pre-surgical. Primi means first, and so gravida means pregnancy. Primi means first. So if a woman has prima gravida, that means it's her first pregnancy. And so primi means first. Retro means all sorts of things. Retro can either mean behind something. Retro can also mean in reverse of something. And so we'll talk about retroviruses like HIV because they have a reverse transcriptase. It makes their genetic material in reverse of what we're used to. And so we will call that a retrovirus. The semi means half. Semilunar is a half moon. A semiconductor can partially conduct electricity. Sub means below or underneath something, like submarine means under the ocean. Super and supra generally mean the same thing. Super can mean in excess of, but supra can mean, supra usually means on top of something in the atomic position. But super and supra are interchanged as prefixes. Sim and sen will be used together as well, interchangeably. Tachy means fast, as in tachycardia and tachometer. Tricycle, that means 3 wheels. Unicycle means 1. Here's something I learned. I knew that zero meant dry, but I did not know that Xerox came from the word dry writing. Xerography was the first Xerox machine, and rather than writing xerography, graphy, they just stuck in X because they were too lazy to write the word out, graphy, and that's where the word Xerox came from. Xerostomia means dry mouth. Stomia, mouth, zero, dry, and so we'll see this word as we go through clinical medicine. We'll talk about suffixes. Those come on the end of the word. And so pertaining to, there's all sorts of suffixes that just mean it pertained to something. And so we'll come back to that. Algia can mean pain. Algia does mean pain. And so if somebody has arthralgia, arth as in the joints, thralgia as in pain, arthralgia is pain. That's different than arthritis. Itis meaning some kind of inflammatory process. Sometimes that's what that means. So arthritis means inflammation of the joints. But it's arthralgia that means pain of the joints. Anything that's a seal is considered a herniation, and a herniation is when one thing passes through a hole that it does not belong passing through that hole. And so men who've had hernias in their inguinal regions, they have a part of the bowel that's extending through their inguinal canal that shouldn't be extending into that inguinal canal. And so anytime something hollow goes through a hole where it does not belong, it ends up with the word seal. And we'll see that as we go along. Centesis means a surgical puncture, usually done with a needle. And so when we do arthrocentesis, we're taking a needle and putting it in the joint to drain fluid. Crin means to secrete, so like we'll talk about endocrine, and those are organs that secrete substances into the blood supply to communicate with other organs. Crit means to separate, and so maybe somebody will order a lab test called a hematocrit, blood, hemo, blood, crit, to separate. And you just take blood and you put it in a little tube, and if it's properly anticoagulated, the little red blood cells will float to the bottom, and the serum will stay on top, and then you can measure the percentage of the blood volume that is made up by the cells, and that's what a hematocrit is. Again, a cyte means cell, so a leuco, white cell, a leukocyte is a white blood cell, red blood cell, erythro meaning red, cyte, cell. Cytosis means pertaining to the cell, so if they have macrocytosis, that means their red blood cells are too big. Right? Adhesis means to put something together, usually some kind of binding. A pleurodesis is something that we'll do. If people have a lot of spontaneous pneumothorax, we'll take the pleura and we'll irritate it with a type of powder and then make the pleura stick together, and so that's called a pleurodesis, binding something together. Ectomy is the surgical removal of something, and so there's all sorts of ectomy words in the medical business. Emesis is vomiting, so again, antiemetics prevent vomiting. Emia has to do with the blood, and so with anemia, they don't have enough blood cells, and in anemia, we consider that red blood cells. But emia pertains to any condition that results in a change in the blood. Genesis just means in the beginning it was created, and so things that are formed from the very beginning are started at Genesis, or you'll hear it called genic, or just gen. Pyrogen, pyro, fever, gen, causing a fever. And we've used all sorts of gen words so far. We've talked about globulins and globulins. Anything that's a globulin or a globulin suffix is a protein. Gram means to record something down. The graph is the instrument that writes it down, and the grapheme is the process of writing it. So the electrocardiogram records it. The electrocardiograph is the one that writes it, and electrocardiography is the process for getting the electrocardiogram. And I don't need you to know the difference between all this stuff, but we see these things, and they kind of mean the same things, kind of mean something different. Again, the pertaining to prefixes and suffixes, there are many of them. Itis, it says inflammation, and that's typical. However, inflammation is not always, itis does not always mean inflammation in the immune inflammation sense. Lysis means to break down. When a lytic process is to destroy, we'll talk about bacteria and antibiotics, and if the antibiotic destroys the bacteria, we'll call that a lytic process, meaning it breaks down the bacteria itself. Unlike a static process which prevents the bacteria from growing, a lytic process destroys the bacteria. So like hemolysis, hemolysis, hemo, blood, lysis, to break down. And so if somebody has hemolysis, they're breaking down their red blood cell for whatever reason. Malacia, mal, bad, malacia, to soften, and so somebody with osteomalacia, osteo, bones, malacia, softening. Osteomalacia means softening of the bones. Megaly means large, enlargement. If they have splenomegaly, they have an enlarged spleen. If they have hepatomegaly, they have an enlarged liver. Oid just means to look like something. So if something's osteoid, it looks like or resembles a bone. An ologist is a medical specialist. An ologist is a specialist who studies anything. So a meteorologist studies the weather. A psychologist studies psychology. And so ology is just the study of. Oma is sometimes a tumor, sometimes just a collection or a growth. The weird one is hematoma. I have a book somewhere that tells me a hematoma is a tumor of the blood. No, a hematoma is a bruise. If you injure yourself and you have a little collection of blood for whatever reason, that's called a hematoma. It's a bruise. All right? It's not a tumor. It's not a growth. But when we talk about other omas, like adenoma, that's a tumor, that's a type of growth. Osis just means any kind of abnormal condition, and so there's all sorts of osis words in medicine. They don't mean anything specific. An ostomy is an opening because os means mouth somewhere. I don't know why that's not. So when we create an opening, we create a mouth, that's an ostomy, which is different than an otomy, which is an incision into, which is different than an ectomy, which is the removal of. And all these words are used interchangeably, like there's not a specific meaning to them, but I just wanted you to see what these specific suffixes are supposed to mean, especially because you're going to see them used in all sorts of ways that aren't specifically this definition. So osseous just means pertaining to the bones. Paresis is weakness, so hemiparesis is weakness in half the body. Apathy comes from pathos. Pathos is Greek for suffering, so anything that's pathy is some kind of abnormality that causes a problem. And so anything that's in pathy here just says some kind of disease process. Penia can mean too few, both quantitative or qualitative. And so neutropenia means too few neutrocells. Encephalopenia, me and a neurologist would talk about encephalopenia, meaning we didn't really have enough brain power that day. We were having an encephalopenic day. Pepsia has to do with digestion, and so we'll see dyspepsia means some kind of, like you'll see heartburn referred to as dyspepsia, some kind of abnormal process with digestion. Phagia means to eat or to swallow, and so if they have dysphagia, they have pain with eating, they have pain with swallowing. A phobia is some kind of fear or avoidance for something. Phonia has to do with the voice or the sound. Pheresis means to carry something from one place to another. Phoria is this feeling of a mental state, so you'll hear the word euphoria describe feeling just wonderful. Euphoria is just this overjoying feeling of wonderful. Going back up to pheresis, you'll hear about electrophoresis, and electrophoresis is a way that we can separate molecules by the way they move across a plate. When we fix something, we'll call it plasty. And so when they repair a joint, we'll just call that surgical repair arthroplasty, repairing it in some way. Plegia has to do with paralysis. So if somebody's hemiplegic, that means they're paralyzed on one side of their body. That's different than hemiparesis, where they're weak on one side of the body. So make sure that you know the difference between plegia and paresis. Apnea has to do with air. Apnea has to do with breathing. So dyspnea means there is some irregularity with their breathing. Apnea means not breathing. You'll hear people with sleep apnea. That means they quit breathing while they are sleeping at night. Poiesis is the formation of something, so we'll talk about hematopoiesis eventually, and that is the formation of the blood cells. Raj or raja just means excessive flow of something, or rhea also means the flow or discharge of something. So rhinorrhea is mucus or other substances flowing from the nose. Rhexis means to rupture something, and so if something gets ruptured, we'll call it rhexis, and I'll have to think. I always miss the rhexis part when I get to this, but we'll talk about it when we talk about surgical things. Sclerosis means hardening, so atherosclerosis is a hardening, a scarring of the arteries. Arteriosclerosis is the hardening or the scarring of the arteries. A scope is in some kind of instrument for viewing, like a telescope, tele, across, telescope to look across, micro to look at something very small, endo to look at something inside of the body, endoscope, laparoscope, laparo meaning into the abdominal cavity to see, right? Or a laparoscopy to look into the abdominal contents, or the abdominal, look inside the abdomen. Somnia means to sleep, and so somebody who has hypersomnia has excessive sleep. Spasm means some kind of involuntary contraction or twitch. Stasis means to control or stop, so hemostasis means to stop bleeding. We were talking about the other day with hemorrhage, and the first thing we want is hemostasis before we move on, and so stasis means to stop. Stenosis is a narrowing, and it doesn't necessarily have to be a suffix. It can be a word by itself. Stenosis, they have arterial stenosis, meaning a narrowing of the artery. Therapy just means treatment, like cryo means cold, therapy, treatment. Cryotherapy is treatment using liquid nitrogen, very cold things. Thorax means chest, hemo, blood, thorax. Hemothorax is blood in the chest. Atosha is labor or childbirth, so dystocia is some kind of interruption in the childbirth or labor process, usually due to the position of the child. Tripsy means to crush something, to break something, and so lithotripsy, litho meaning stone, tripsy Some people who have kidney stones, we can put them in this special bath with water, and we can make that water vibrate in such a way that it delivers energy into the stones and crushing them. So we can do lithotripsy in a bath. We can do lithotripsy by taking a catheter and run it up into the ureter and destroy the stone that way as well. So tripsy, to crush something, and usually we hear lithotripsy, lithostone, tripsy, to crush. Again, we've seen all that. Good. All right, I think we're going to stop right here and pick up medical terminology at our next lecture because it's definitely going to take me more than 10 minutes to get the rest of these slides. So that being said, when we come back, we'll talk more about medical terminology, and when we're done talking about math and terminology, we'll eventually get to section 2, the exciting part of pharmacology, cardiovascular medicine. So until then, aloha.